Have you ever imagined treating knee pain without surgery, injections, or daily painkillers? What if I told you that a treatment most people fear, radiation, could actually reduce joint pain safely using extremely low doses? It sounds shocking. But a newly published scientific study has confirmed something that doctors in parts of Europe have quietly used for decades. Low-dose radiation therapy may significantly reduce pain and stiffness in people with knee osteoarthritis. And today, I'll explain exactly how it works, what the scientists discovered, and whether this could become a real treatment option in the future. First, let's quickly understand the problem. Osteoarthritis is the most common form of arthritis in the world. It happens when the cartilage that cushions your joints slowly wears away. As this protective layer breaks down, bones begin to rub against each other, causing pain, swelling, stiffness, and reduced movement. The knee is one of the most commonly affected joints because it carries so much body weight. For many people, knee osteoarthritis makes simple daily activities like walking, climbing stairs, or standing up incredibly painful. Current treatments usually follow a frustrating path. Patients start with lifestyle changes and painkillers. If that doesn't work, doctors may try injections. And when everything fails, surgery becomes the last option. But there is a large group of patients stuck in the middle. Not bad enough for surgery, but suffering too much to live comfortably. This is exactly where low-dose radiation therapy comes in. Radiation therapy is normally associated with cancer treatment, where high doses are used to destroy tumors. However, in this case, the radiation dose is extremely small, less than 5% of what cancer patients receive. In countries like Germany and Spain, doctors have used this approach for joint pain for many years. But until now, there wasn't strong scientific proof showing that it worked better than placebo. That's what makes this new study so important. Researchers conducted a randomized, placebo-controlled clinical trial, the gold standard in medical research. Participants didn't know whether they were receiving real radiation or a fake treatment, which helps eliminate psychological bias. The study included 114 patients with mild to moderate knee osteoarthritis. They were divided into 3 groups. One group received a very low radiation dose, another group received a slightly higher low dose, and the third group received a sham treatment with no radiation at all. Each patient underwent 6 treatment sessions, and during the follow-up period, they were only allowed to use mild pain relief like acetaminophen. This ensured that stronger medications didn't influence the results. After 4 months, the researchers analyzed pain levels, joint function, and overall improvement. The results were striking. In the group that received the higher low-dose radiation, about 70% of patients experienced meaningful improvement in pain and mobility. In comparison, only 42% of patients in the placebo group reported similar improvement. This difference clearly showed that the treatment worked beyond placebo. Interestingly, the group that received the extremely tiny dose did not show significant benefits. This tells us that dosage matters. Too little radiation doesn't produce the desired anti-inflammatory effect. Even more important, no radiation-related side effects were observed. No skin damage, no increased pain, no serious complications. This directly challenges the common belief that any radiation exposure is automatically dangerous. So, how does this work? Scientists believe low-dose radiation reduces inflammation inside the joint. It affects immune cells that cause swelling and pain, calming the inflammatory response rather than damaging tissue. Think of it not as destroying cells, but gently resetting the inflammatory process. The lead researcher explained that many patients with knee osteoarthritis are forced to choose between long-term pain medication or joint replacement surgery. Both options carry risks. Low-dose radiation could become a middle ground treatment, non-invasive, short-term, and potentially long. However, this doesn't mean the treatment is ready for everyone. The study followed patients for 4 months, and researchers are now collecting 12-month data to see how long the benefits last. The trial also focused only on mild to moderate osteoarthritis, not severe cases where joint damage is advanced. Larger studies are still needed to confirm the findings, compare costs, and determine who benefits the most. But even with these limitations, the results are groundbreaking. For the first time, there is strong scientific evidence supporting a treatment that was once considered unconventional. It opens the door to a new way of managing chronic joint pain without drugs, injections, or surgery. If future studies confirm these findings, low-dose radiation therapy could become an important option for millions of people suffering from knee osteoarthritis. So the next time you hear the word radiation, remember this: sometimes, in the right dose, even the most unexpected tools can heal instead of harm. If you found this explanation helpful, make sure to like the video, subscribe to the channel, and share it with anyone who struggles with knee pain. Thanks for watching, and I'll see you in the next video.